Excellencies, dear colleagues, dear friends, it's really a great privilege, but also a great pleasure to be here in Bangalore for this second conference, of which we are happy and proud to be a co-organizer. And to put it in a historical perspective, maybe I may pick in where the previous speaker left us at some point. That is the Alma-Ata Conference and the Declaration on Health for All by the year 2000, by a strategy of primary healthcare. And maybe few people really know that this concept was born here in India in the 1960s during work on tuberculosis control, and two of the people who were their champions were Dr. Mahler and Dr. Mersenier, who agreed that things should change and that there should become a more patient-centered, community-based system of healthcare. But they disagreed on, not really disagreed, they parted ways in two strategies. Dr. Mahler said, let's try top-down. He went into WHO and finally became the Director General who presided over the Alma-Ata Conference. Dr. Mersenier said, let us do it bottom-up. He went to Antwerp and started up the course of public health, which is still existing nowadays. And he said, let us flood the world with people who share our ideas and let us train them. So it is quite interesting to notice that one of the participants of that course, Dr. Devada-san, who is sitting here, actually, I think you graduated in '93, and many others after you from India came back to India and set up here the Institute of Public Health, which is still working in the spirit of Alma-Ata. So I would not say that the circle is round, but the vision of these two people at the time, and many colleagues here in India too, I think, have after a few decades really resulted in tangible results. Now the Institute, not only because of this history, but I think really also by conviction, has always been a champion of the universal health coverage, but of universal primary health care, whatever we may call it. Names change over the decades, but the concepts remain the same. And we have found it exactly 11 years, I think almost to the day, necessary to reiterate that commitment, because we were living at that point in Brussels, actually, the birth of the Global Fund for, which was then still called the Global Fund, period, and then the Global Fund to fight AIDS, and finally, to respond a little bit to the criticism that this was too narrow, the Global Fund for malaria, to fight AIDS, malaria, and tuberculosis. And in 2011, we really on the eve of that foundation, we organized a conference which was called not Health for All, but Health Care for All, with the aim really to, I'm not going to say as a preemptive strike, but as a warning, please do not move again at an international level in these vertical tendencies, but do concentrate also on the fulfillment of the promise of Alma-Ata. And it was a strange conference because one day we had ministers from all over the world, and as you say, NGOs and representatives of communities. It was all about let us do primary health care and keep that as a thing. And on the second day, the international organizations came and they say, primary health care, it's good, but we need to do something more. And this is not what we're going to get money for. That was actually the most important thing. And I think we have now lived over a decade in which, okay, I think we have had the Global Fund and it is still there. And there are certainly, I think we must not deny that, great achievements over the past decade, also here in India. But by and large, the consensus has also grown at that level that we need strong health systems to sustain the results of these efforts, not only of the Global Fund, but also of a myriad of other global initiatives which we have seen over the past decade. Now, this predictable and this, I think, in my view, unavoidable turnaround, I mean, we could predict it 10 years ago that this would happen, has been redefined, and now we call it universal health coverage. What's in the name? But I think An important aspect is that whereas in Mexico, I think it was in 2008, the slogan was still universal health coverage or strong health systems to achieve the Millennium Development Goals. Somewhere the turn has shifted, and again, we are back at the concept of primary healthcare and community-based, patient-based healthcare systems. And that in itself, I think, is an important achievement. What I understand now is that people are having great conferences in the public and also behind doors about what shall happen with the Millennium Development Goals after 2015. And I believe there is a strong tendency that this should actually become assuring primary healthcare for all, or something in the sense, universal healthcare for all, which would be more consistent because even at the start of the Millennium Development Goals, in terms of education, the Millennium Development Goal for education is assure primary education for all children, period. It is not about how much English they should know or about how much mathematics. It's about assuring this access. And I believe it would have been consistent from the start if there would have been one similar MDG also for health. But okay, maybe we are getting there. And then, if that is there, then the challenge is also to achieve it. And assuring comprehensive healthcare is the duty of the state, the community, however you want to define it, but it's a question of organizing solidarity and assuring quality and access. And this must be based on mechanisms of financial and social solidarity. I think there's going to be a big debate, and it's ongoing, on what the role of the international community is in that sense. I think there is an obligation for solidarity, but it should not take away the duties of the state. And there should be made the difference between poor states and deficient states. And of course, deficient states is a problem on its own, but the financial solidarity between countries will be something that should remain high on the agenda, be it in a different concept, a concept beyond aid, as some people call it, but of international solidarity. This is of little importance, I think, to countries as India and the emerging economies, where the resources and the technology and the expertise is really available. But of course, there is still a problem of management, of efficiency, of having all this really accessible to poor population and individuals. And not only accessible, but also of quality, because universal health coverage, I would hope that most people think between brackets of quality health coverage, because that is a very different story, I believe. Now, the challenge to address these disparities and these lacks of efficiency is really a formidable challenge, and in many senses, ethically, economically, politically, socially. And it is up to the authorities and the civil society of the country to get this organized. So the role of the public health professionals, of the public health authorities, and also of the public health scientists is really enormous. They are really key actors in this endeavor. At the national level, but we also know that certainly nowadays that many of the determinants and the implications and the duties and the repercussions have global ramifications. So also in that sense, I am pleased to be here, not just only for the past, but also for the future. I am really convinced that there is mutual interest and mutual need to collaborate on this level. Now, India is, of course, it's a continent. It is certainly not up to me to I think this will be done by the gatherings, to go into detail how India moves forward to a universal health coverage, but I have been following from a distance, among others, the launch of the Rural Health Mission in 2005, at least by name, and now recently complemented by the National Urban Health Mission. And I do realize that the challenge to turn these program-based policies and the organization and the culture to a more patient, a more person, a more population-centered one must really be difficult. And simply in managerial terms, we know that change is very difficult. I believe, and I think we can find it here today, that there is political commitment that will be sustained to bring about ensuing reforms. But then there is still the technical challenge, as you have said it, how to do it. Simple solutions can have, and usually have, unexpected side effects. And as I heard yesterday, it's all very nice to have an ambulance, but if that results in evacuating the problem out of your ward, then can also be a negative impact. And so things are really complicated. And on the other hand, you need some rapid successes, because otherwise the political support, and particularly the public support, will wane and will turn possibly in favor of a more private-oriented approach. Indeed, I think one of the big differences between continents, and one of the big issues probably of the 21st century, and we see it in the American elections, we see it in the European upcoming elections, is how should we consider healthcare? Is it an economic commodity as any other? Or is it a human right, which is in fact a public good? And it's strange to see that people can think so differently, and electorates can think so differently about such an enormous issue. Now, the role of scientific and academic public health institutes in these difficult questions is enormous. I think they have an essential task and a major responsibility. Science is science, but public health science cannot be done without public goods, without keeping universal rights and values as an axiom. But from there on, you must analyze, and you must address the complexities of health systems research, which Deva has already highlighted, with whatever is possible in terms of scientific rigor and interdisciplinary expertise. You must even address basic research questions, not only biological, but also sociological, psychological ones. It's all about humans, and we have to understand human nature. And sometimes we do not understand human nature. In fact, usually we do not understand human nature. We should not shy away from these purely scientific questions. And whether research results should be published, yes or no, I think in any case they must be scrutinized by quality systems, by peer review, before being tested and translated in policies and practices. So you really need to be scientists and public health practitioners at the same time. And even during the rollout, scientists are really needed to follow up all the effects, the side effects of new strategies, and to retranslate that in new knowledge and new approaches. So the role of public health researchers is really enormous, and without them, I don't think the rollout of universal health coverage will be successful. On top of this, they must transfer this knowledge to new generations of actors. They must teach, they must coach, they must train people, because as we all know, only an intelligent and critical workforce will be able to implement the changes that are needed towards universal health coverage. So the public health institutes, as Deva is setting up, and others elsewhere in Egypt, are really critical to be to the future of universal health coverage in India and elsewhere. And apart from all these medical and managerial and scientific issues, they must also be able to work in international fora, to work in management. So what is asked from these people is really formidable, and therefore I congratulate you to set up this young but really fledgling, thriving institute, which shows, I think, its capacities also by organizing this conference. And it is a privilege for us at the ITM, and I say this also on behalf of the Belgian government and its Ministry of Foreign Affairs, to be involved in this exciting endeavor. We really look forward, also as scientists, to this conference and to its proceedings. And I must also say on a personal note that this mutual benefit and interaction is not just a fruitful and an interesting one, but also a very pleasant one. One in which we work and debate very heavily on how to organize international collaboration in the 21st century, in an era beyond aid, beyond the donor-recipient relationship, which is not such an easy endeavor. And it is interesting to do here in Bangalore, where Thomas Friedman has found out that the Earth is flat. It is clear he was standing on a golf course and not somewhere in a village. But therefore, and I think really also these amicable relationships that we have, I really look forward to the conference, but more even to the future collaboration with the Institute of Public Health, but also with like-minded institutes all over the world to achieve not only universal health coverage here in India, but also elsewhere in the world. Thank you very much for your attention, and I wish you a successful conference.
Dr. Bruno Grisels. Training has been a core component of activities at IPH. We've been extensively involved in capacity building of health managers towards strengthening health system. To further this endeavor, we are starting an e-learning course in a Masters of Public Health in Health System Management. We take this opportunity to invite Dr. Bruno Grisels to formally launch and speak few words on the program.
Being a director is that you put things in motion and you let people work, and then 5 years later you are just asked to push a button, and that is all you have to do. So I would certainly claim no responsibility for this course, which is, I really think, a course of the future, and I hope that we will be able to collaborate is to extend this course in public health and to mix it with face-to-face systems, and not just only in India, but all over the world. And we have been discussing already the last few days this fantastic idea of a global institutes of public health that would work together on different continents, share ideas, share the things that are universal, because let us not forget, I hope that universal health coverage will not become another global strategy to implement. Universal health coverage is about the value, but it is very circumstantial. It is very local, and it has to be done by the local people. So, as I would really be ashamed to do this on my own, because this is such a huge teamwork, I actually would ask also not to complicate too much the direction of these things. Kavya to come with me, and me as an old guy from Antwerp, and you as a young lady from India, you represent the future, and to push the button together with me. I hope Deva agrees that this is a fit thing to do, so please come up and we can push the button together. And so together we are very proud to open this online course on public health, this one. Okay, and here we go. Thank you very much.